Hello, thank you so much for joining us today, both in person and on Zoom. I am Alexa Smith, and I am the Educational and Exchange Event Program Manager for the Office of International Programs. And we thank you so much for joining us today during International Education Week. I do have a message from Kimberly Connolly, the Senior International Officer, and the rest of us in the office. International Education Week 2024, this year, November 18th through the 22nd, is an opportunity to celebrate the benefits of international education and exchange worldwide. This joint initiative of the U.S. Department of State and the U.S. Department of Education is part of our efforts to promote programs that prepare Americans for a global environment and attract future leaders from abroad to study, learn, and exchange experiences. International education is all about expanding horizons, making connections, and establishing mutual understanding between people in the United States and other countries. To sum it up, we want you to explore. Explore opportunities to engage in an IEE. Explore exchange programs for international students to come to the United States. Explore fields of study that need bright minds, including STEM. Explore the great minds that are changing the world after having been part of a U.S. exchange program. Explore languages and cultures new to you, and explore all the opportunities international education offers. And truly, I think this has to be one of the most fitting presentations we could have during International Education Week, the Kovac International Observership Award. Dr. Kovac, of course, can tell you a little bit more than I can as to the creation of this award. We did start in 2016, and you can see we've gone all the way to 2024, but I think Dr. Kovac really embodies the idea about coming together and collaborating and learning from each other and figuring out what does this person do well that maybe this person doesn't, but they do this really well that maybe we don't, and just really, I think, coming together to make a positive change in the world. And I'm so appreciative of Dr. Kovac's efforts, initiatives, and his friendship with our office. So, Dr. Kovac, do you want to say anything?
Thank you, Alexa. One thing I definitely want to thank is Kimberly Connolly, Alexa, Stacy, and the Office of International Programs, because they really put the effort to do all the paperwork to make it so that we can have a good experience, not for our medical students and residents going abroad, but also for students and doctors and residents to come to KU. One of the things that in prior years, the Kovac awardees came at different months. But one thing we especially wanted to connect it with November, and because this is International Week, and there's different activities that did occur, like the Mani Mani lecture on Monday. Yesterday, they had the students' poster presentations on them going to different countries. Today, the presentation will be the Kovac awardee. And then don't forget tomorrow. Tomorrow, there's the OIP celebration for the end of International Week from 5 to 7. And you're all invited. Please come. Bring your significant other, wives, family. Because there will also be other medical students, residents, doctors from around the university that will come in. You know, we can see from this slide that this is actually the 7th year we're having this. We did take off 2 years because of COVID. The reason they started back in 2015, I went to Lima, Peru, and gave a presentation. And then on one of the days I had off, I went to the National Cancer Institute, the Peru National Cancer Institute, and I toured around, met the staff, residents, and one of the doctors there at that time, it's Dr. Ron Urquizo. He was the chair. He's currently still at the institute. He said, well, we didn't know about your drug, but he said, come back and come back for a day, a week, a month, and teach us. So one thing at that time they wanted to learn about was fiber optic intubation. And so I did go back and teach them on several other years. Consequently to that, the next year, one significant individual I met is Dr. Alfred Adu. And Dr. Adu is a physician anesthesiologist, but also a minister pastor from Kumasi, Ghana, from the Kamfanochi Teaching Hospital. And one of our residents at that time, Dr. Mark Brulette, invited me over his house dinner and to meet Alfred. That was a significant connection because in talking to Dr. Adu, I realized that maybe this also would benefit the Ghana residents. One thing about Dr. Mark Brulette, we consider him sort of like the Christopher Columbus, so to speak, because he opened our eyes. He was one of the first residents to go to Ghana. And then I followed and I went to just see, well, what do the residents see when they do? Well, that relationship has developed to be a bidirectional relationship. If you were to ask me what is one of my passions, global health education. Many times individuals say, am I going, when I go to Ghana, am I going on a mission? No, I'm not going on a medical mission. I'm going on global health education. And for all the residents interested in missions, we have plenty of different staff in our department, Dr. McCarthy, Dr. DeRuiter, Dr. Sissel, that go with surgical groups on medical missions. But I believe in the philosophy that, you give a person a fish, you feed them for a day, you teach them how to fish, you feed them for a lifetime. So I really believe in global health education, and both when we go to Ghana or Peru, and they come to, then I will learn as much from them as they hopefully can learn from us. Even this morning with the medical students, I learned a different technique that Amma, who you'll learn about, is how she had a special technique of nasal intubation using a bougie. Okay, but that being said, I'm really happy to well, first, before that, I want to mention that in our department, both Dr. Staub and Dr. Hendren have their support for global health. And one of the things that we've started is a global health track for a resident. And Kwabena in the audience is our first global health resident, with the idea that starting out in the CA1 year, continuing to the CA2 and CA3 year, which will culminate in an international experience, we can hopefully develop an educational program as well as perhaps, and I hope, a research project along with the residents in Peru and Ghana. And so this bidirectional education and research will develop, because the University of Kansas, we have cooperative agreements with hospitals for the exchange of education, research, and culture. Well, that being said, it is my privilege to introduce Amma. I think all of you have got to know her in the last 2 weeks. And I told her I'm not going to really give her CV and talk to her, because part of the thing she'll talk to you about her education, her family, life in Ghana, and at CATH, the Kamfanochi Teaching Hospital. So thank you very much.
Thank you. So before I do anything, I don't want to forget, I want to use the opportunity to actually thank the OIP, Stacy, Kimberly, Alexa, for the opportunity to be here. There have been ups and downs, but I finally made it here, and I just want to say you bought into the idea of the COVAC Awardee Observership Program. For me, it's been an opportunity to have cross-cultural interactions with at least everyone here. as well as meaningful connections that I will have forever. And then, most importantly, lasting memories that I'll have. So, yes. Do I? Okay. Yes, so my name is Ama Kwachiwa Beduado, and you see a lot of alphabets down there. They are just certificates that I have obtained throughout my career or throughout my schooling, obviously. I have a BSc in HB, that's human biology. I have an MBCHB, a diploma in anesthesia, and a membership with the Ghana College of Physicians and Surgeons, as well as a membership in the West Africa College of Surgeons. I'll explain what it all means as I move on. Before I say anything, you see me here with a lot of Ghanaian apparel, my beads, my clothing, and it shows you that I am very interested and abreast with culture. I love culture. This is something we call Edinkra symbols, and I felt this was representative of the COVAC awardee observership program. It actually represents someone who I got to meet during this observership program, who connects me to Kansas Medical Center or Kansas University Medical Center. And I would say that is Prof. Kovac himself. He has been an emblem and a symbol of support, cooperation, and encouragement. And I'd just like to honor him before I move on to my presentation. So here, before I go into everything about myself, Dr. Kovac, with most of the OIP and some biomedical technicians here in Kansas, have been very instrumental in donating a lot to Ghana. We get a lot of laryngoscopes, we get a lot of gadgets. And the recent gadget we got was an ultrasound machine. Now, how to get it back to Ghana was a problem. They tried to take it apart. So that's Dr. Edu. They tried to make it as small as they could. And they sent it to Mark in New York. But then Mark had to take it up, take it down some more to be able to transport it. And then here they bubble wrapped it and made it into another packaging, and then decided to label it carefully. They managed to get it to Ghana. So here we see it put back together, presented to the CEO in Konfanochi Teaching Hospital with some of the staff in my department. Those who met Sam can see him on the right, and Dr. Edu in the middle, there's Sophie in the middle. And so, yes, these are pictures of the ultrasound, and that's our upcoming pediatric anesthetist holding the pediatric probe. She's very excited because this ultrasound has a pediatric probe, the first pediatric probe we have in CAF. So we are all excited. We can't wait to start regionals on pediatric patients. And yeah, these are just pictures of when it was taken to the kids OR in Konfanochi Teaching Hospital. And that's our pediatric anesthetist holding the probe. So about me, if you want to find me, you can locate me on any of these. But I come from Ghana. It's a country in West Africa, for those who don't know. I just got to realize that Ghana is a bit bigger than Kansas as a state. So we cover, but on the map, when you look on the map, it looks like Kansas is way bigger than Ghana. So I always thought Kansas was bigger than Ghana. But I think we have about 10,000 more kilometers, squared kilometers, more than you guys do. So that's, it looks really small, but we are just a bit bigger than you guys. So that's Ghana and West Africa. And when you look at this picture, you realize that so the regions I'm going, Ghana has 16 regions, but the regions I'll focus on are 3 regions in there. The capital is in Greater Accra, which is the orange in the little space down there. Then the eastern region is the yellow region, and the Ashanti region is where Konfanochi Teaching Hospital, which is CAF, is found. So these 3 regions are what I'll focus on because Greater Accra is where I grew up, and that's the capital. That's where my mom stays. Eastern region is where I am from. So that is where my parents are from. That's where you would say my village is. So, and then Ashanti region is where I work now. So it's lined up, so you see. And it was good to know when I was preparing this presentation that Ashanti region actually serves 13 regions out of 16 regions. In the Konfanochi Teaching Hospital serves about 13 regions out of the 16 regions in Ghana. So it seems we cover a lot of medical coverage. Now, who is Ama? So I am married, I have a son, I have a daughter, and that's my family, okay? And these are my siblings. We have arranged ourselves according to oldest to youngest. So my older sister is on the left, followed by my older brother, then I would come, and then my youngest brother, and then my parents are the ones seated. So and then this is like the whole bunch, so with all the grandchildren in the picture, yes. Hello? Okay, sorry about that. So here you see me, that's my older sister with me. And this is just to show that I enjoy dancing. So that's one thing I have in common with my older sister. This is my older brother. One thing I enjoy doing is also playing video games. That's with my older brother. And then one thing I share with my youngest brother is the fact that, well, we have a lot of connection when it comes to art, when it comes to dressing up, when it comes to stylish stuff. So that's my younger brother. And then I retook this picture when I turned 30. This was when I was 4 years old. Those are my grandparents who are still alive that I really care for. And then these are my uncles. They had to represent in this. They have been very supportive in my life, in my career path. And that's the whole bunch, all the in-laws. So the wives of my brothers and the husband of my sister. And that's my mother-in-law with my kids. That's my mother-in-law's sister with her kids who are in Virginia. And that's my husband and his brothers. So yes, they in my country, when you are married, and basically my husband's brothers are like my husband. So like they are also called husbands. So yeah, I have 3 husbands. Yeah. So this picture is to bring out the fact that I like to make clothes. So this is something I actually did myself. I love to swim. I love culture and African print, anything African, beads, all those things. That's Ama. Yes, culture. This is also to represent what traditionally how we dress up in the Eastern region. So yes, that's culture. I love to play basketball, or I love sports. Basketball is what I'm good at. That's why I love to play basketball. And then I am also a red belter in Taekwondo. So yes, maybe Prof. Kovac will meet me outside and then we can, yeah. Mm. And then I love to exercise as well. So this is just to show, normally when people are getting married in our culture, we pack up drinks and suitcases. There are lists of things that the man, he has a list given to him from the bride's family. So he has to present that to the bride's family for the bride. So basically it's like a trade. And so one of the things I also love to do is to decorate these things that people send to the bride's family for the bride. So this is something I've done before, and this is something I've done before. I mostly did it with my mom. So, and then we also do that for funerals as well, where you present things. And then this is a picture of me and a colleague at work. Basically, our mugs say certified backstabber. So I'm sure, yes, those of you who are anesthesiologists will understand. That's me and Sam and Mimi. And then that's us trying to hang out. Well, at the end of the presentation, I'll kind of talk about World Anesthesia Day. Every time there's World Anesthesia Day, we try and take a trip or do something other than anesthesia. So this is one of the things that we did during one of the World Anesthesia Day celebrations. So where did I school? For my primary and junior high school education, I went to Queensland International School. It is in Greater Accra region. These are, this is actually a picture of the upper grade class that these are people who want to be doctors. So hopefully, maybe some of them will become anesthesiologists. We never know. Hopefully they don't change their mind somewhere along the path. And this is a poster of a free health screening program that we basically did for my basic school. So this was one idea I had to go back when Queensland had its 25th year anniversary. So these are a team of doctors that we did that with. So, and this is my senior high school, Ghana Christian International High School. It's also in the Greater Accra region. Yes. And then this is where I had my university education. So Kwame Nkrumah was our first president. So this university is named after him, Kwame Nkrumah University of Science and Technology. So this is where I got my BSc Human Biology and MBCHB as well. So, and then I went on to Confanoche, where I did my anesthesia program and had my membership. So this is a picture of me, diploma, when I finished my diploma, and this is a picture of me when I finished my membership. So just for you to understand what our pathway is like, after high school, basically if you want to do medicine, you go to medical school. Now in medical school, there are 2 degrees, basically. You get your BSc Human Biology and then your MBCHB. Then after that, you have to do what we call house job. And during that time, you're a house officer. So we have junior house officer and a senior house officer. It takes 2 years to finish your house job. Now, during those times, you do 4 specific rotations. You could do pediatrics, internal medicine, surgery, obstetrics, and gynae. Now, the reason why you have to rotate through all this is because after this, you become a medical officer. And we do that because Ghana, not everybody will specialize. So when you become a medical officer and you intend not to stay in a teaching hospital, you should be at least equipped with certain basic skills wherever you are placed all over Ghana so you can address certain concerns. So things like cesarean sections, you try and do inguinal hernias, you would be able to, and then basic things like malaria, internal medicine matters, and also pediatric matters. So they equip you with enough skills. By the time you're a medical officer, you should be able to be thrown anywhere around Ghana. Now, if you intend to specialize, you write your primaries exam and enter residency. And anesthesia is 3 years. You can decide to just do your Ghana college membership or specialization, or do a West Africa. You can decide to do both or one. It doesn't matter. Once you have decided to specialize, then you need to do a membership. So when you specialize, it's like they call it, you are doing a membership. And then when you are done, where you guys would say the person is an attending, we'll say you're a specialist. Okay, so a specialist is basically someone who has finished their residency. Then you can decide to do a fellowship. That is also not compulsory. But if you want to be in academia or you want your voice to be heard, it's always best to obtain the highest form of degree. So then you obtain a fellowship. You can even do a post-fellowship program. It depends on you. Now, the diploma is not compulsory. It's just like a stepping stone. It opens your eyes to what anesthesia is all about, because mostly in medical school, we don't get to do so much of anesthesia. So I just took the diploma kind of to have an open mind of what anesthesia really is. So it will help me with my membership program, or membership exam, sorry. So these are just pictures of me at work. That's me with our sedation box. So when you want to sedate patients for CT scans and stuff, this is the bag that we use, yes, basically. And this is when I went for my BLS and PALS training. I took this picture because we went to theater and I realized that we were wearing gas colors. So I represented isoflurane, he was sevoflurane, and that's desflurane. So yes. And yeah, so these are just pictures. This is a picture of us transporting a baby. So sometimes we have remote theaters. Theaters will be operating rooms. And then after the case, we now have to send the patient maybe to pediatric ICUs. But because it's remote and we don't have the bridges that you have, we have to kind of go outside the hospital and enter again through another entrance. So that's us during transport. And then, yes, and then that's us doing a block. So, yes. This is Essential Pain Management course. So this is a course that was actually started by the WFSA, that's World Federation Society of Anesthesiologists. It's just to give people, kind of bridge the gap. It's also like this global health thing where they are trying to make people understand how to treat pain. And it's not just anesthesiologists, every other person, nurses, technicians, everyone, so they have a better idea of what pain is. Because in some societies, people think you need to go through pain before you have actually like you actually have the audacity to be a mother, basically. It's like there's no room for epidural. They have to go through the pain to be called mothers. And we still have that. So these programs actually, they are cultural centered. And then they come in there and try to understand what the culture is. And then they try to help us find ways of bridging the gap between the pain and labor, like all those things that will help with pain management. So that's essential pain management, how to recognize, assess, and treat pain for the regular person. So they came in there and trained us. So and this is a class, airway class I had with medical students that Prof. Kovac was wild about, because today I met his class and they were only 4, but in my class there were about 67 students. So yes, so that's the class of airway for anesthesia medical students, and we held airway gadgets and said airway to take a picture. So yeah, that was when Johanna came to Ghana. And this is a glide scope that Prof donated to us not long ago when he and Johanna came to Ghana. And I had to bring this picture because this man has been very instrumental in my career path. When we talk about mentors, we talk about people who would push you even when you don't think you are capable of doing what they think you are capable of a lot, but then you don't even know how much you're capable of. And that's this person, and he's called Moses Yang Frimpong. We call him Fire, but he has been very instrumental in my career path, and I thought I just had to bring him up. So moving on, these are pictures of our theaters. So this is the accident and emergency theater. Prof. Kovac wanted you guys to see this because we have 2 beds in theater. And I guess this theater was designed such that if there was, like, in the future, some transplants going on, you could just move from here to here. Or if there's a separation of, the separation of Siamese twins have been done in this room. So basically just to make it easier to move around when it comes to working on 2 patients. And so this is an example of what the number of cases we do per theater. This is for October. You realize that for our NAXA, it's just our obstetric theater. Okay, so we have 2 theaters for obstetrics. One we call the NAXA, and then one which is the special ward. So just before the kids who are, you see ONG SW, that's ONG special ward. Now, NAXA has the largest number of cases that we do, most of them being emergencies and just a few being electives. But the total number is about 937. That was last month. That approximately about 11,300 cases in a year for us. So that is currently for our senior specialists or consultants, that's those who've done the fellowship, we have just about 9. We have about 12 specialists, and then we have, for the 3rd-year residents, just 1. We have, for the 2nd-year residents, 18, and then for the 1st-year residents, we have about 14. So it's a growing department. Yes, a total of 54 doctors. So these are some interesting cases that I've done that I would love to share. So upcoming is a 32-year-old tracheal laceration via a suicide attempt, managed to miss his carotids, but totally slashed his trachea. He changed his mind that he wanted to live and reported to the hospital himself. So here you can see the tube spanning from the lower jaw all the way into the trachea down there. Yeah. So that was an interesting case that we did, but he's alive. So, and then there's a 3-year-old male who swallowed a padlock. He was booked for rigid oesophagostomy. We did an inhalational induction and set the line, but via direct laryngoscopy, we were able to remove the padlock. So that is a picture of the padlock in the airway. And then that was about 3 centimeters or, yeah. And then there's a 57-year-old diabetic. For those who are not in there, like my mom, maybe this particular picture may be a bit gruesome. So just, yes. So it's necrotizing fasciitis on the neck and face. She was basically booked to have debridement done. So we admitted into the pre-op, made sure that her glucose was well managed, and then we sent to theater. Now, I turned around to basically, you know how necrotizing fasciitis can be very, yes. So I turned around briefly and I came back, and the oral maxillofacial surgeons were actually debriding the chest wall as well. And so we had to call general surgeons because that's not an area they normally do. And they had extensively debrided the chest wall. So it was a very difficult one as well. Then there was a 9-year-old femoral fracture. We did a subarachnoid block. So I realized most of the cases you give midazolam, but we don't do that in Ghana. Not that we don't have midazolam, we have midazolam, but I guess we have other ways of creating anxiolysis. So we do a lot of verbal anxiolysis, and maybe because of the cultural differences, maybe our patients are a bit more understanding. However, this was a 9-year-old. We did a spinal for him, and I named it teleanxiolysis because I just started a cartoon on my phone and gave it to him behind the drapes. So that's him watching cartoons as they do the surgery. And then I realized when I mentioned submental intubation, and a lot of you haven't heard about submental intubation. So that is submental intubation. So it is basically almost like intubation. People would ask, why would you not just do a nasal if this was for oral maxillofacial surgeons? But the thing is, they needed the tube, first of all, away, and the patient had panfacial fractures. Doing a nasal, according to them, wouldn't give them the perfect midline that they needed to do the whole plastics. So they needed everything away from the face. So what they do is you do a regular intubation, then they make an incision in the under the jaw, basically, through the tissues over there. You pass it under the tongue, and then we reconnect your tube. They normally use a reinforced tube because basically with this kind of intubation, it can always kink if you use a regular tube. So that's a submental intubation. And then this is a case that was too unstable to move to surgery. She was a 16-year-old, needed a cesarean section done. So we just set up an ICU and did the cesarean section there. So these are basically cases that we've done. These are some of the challenges that we have in our setting. We need to change our cylinders ourselves. Sometimes we realize that the scavenging may have some torn areas, and sometimes we need to fix it. In the meantime, at least, before they address it, because sometimes it takes a while to address certain things like this in our setting. And then sometimes you get there and there are so many drugs that have been placed in the fridge and they weren't labeled with dates. And so you have to end up throwing all that away. And yes, that can be troublesome. Now, when I came, I talk a lot about gadgets because I'm always excited to see how how much you guys have. You have so much. You have the standard things. You have everything. And the monitors do everything for you. They chart for you. They do everything for you. Now, I wanted to point out this because you realize that the ECG electrodes are in my palm, but then the monitor is reading. You see an ECG reading. You see pulse oximetry reading. And the pulse oximetry pulse down there, which is 103 in the blue, is matching with the ECG. So you would think that it's on a patient and it's reading the right thing, but it wasn't. So these are some of the limitations that you could have, especially in my setting, when you rely on monitors. So you still need to remember that the best monitor is the anesthesiologist himself. And so every time you need to keep an eye on your patient and not the monitor. So that was just. So World Anesthesia Day. Now, for us, we started celebrating World Anesthesia Day in 2020. And basically, these have been the themes for World Federation of Society of Anesthesia. However, for all the years from 2020, we've tried to celebrate it. For 2020, we just told Ghana about what anesthesiologists do, because basically a lot of people didn't know what we did for our jobs. So we just took pictures and told people about us. So when you go to Ghana Anesthesiology Society, you would see, yes, that's Quavs. Yeah. Yeah, so we just took pictures of ourselves and then told people what basically we do, what we do, our jobs in pain and all that. And then we went to radio stations and went on TV to talk about what anesthesia does, what we can do for pain, and to demystify all the things all the cultural myths that were there about pain, how you have to go through pain before you can be called a mother, and so we had to demystify all those things. And then 2021 was about teamwork. So we just basically went around the maternal and pediatric blocks and then just gave them something that we had put together, some toys, some snacks. So that's what we did. And then for 2022, we had a video put together because it was about safe resuscitation. So I'll just quickly show what the video. So that's actually something I also do. I put together videos. So, yeah. You'll find all of them on Ghana Anesthesiology Society on Instagram.
Okay, to the left, not to the right. Now lean back. You know the vibes, dope nation. What be your price? Yesterday price, no be today price. Hey, to the left, not to the right. Now lean back. You know the vibes, dope nation. What be your price? Yesterday price, no be today price. We do for one side. Yaro don't try. Mommy gun short. I be you know the vibes. We do for one side. Yaro don't try. Mommy gun short. I be you know the vibes. We the carry first, yeah for Ghana. If you with it, Moshe Jama, make you no carry bed in your cabana. Auto credit in your cabana. If you enter your head, in a fama, you make it ziggy zaga, make it hala boys, aquaba. Ventus, man, aquaba. Okay, to the left, not to the right. Now lean back. You know the vibes, dope nation. What be your price? Yesterday price, no be today price. Hey, to the left, not to the right. Now lean back. You know the vibes, dope nation. What be your price? Yesterday price, no be today price. We do for one side. Yaro don't try. Mommy gun short. I be to the left, not to the right. Now lean back. You know the vibes, dope nation. What be your price? It's the day price, no be today price. Hey, to the left, not to the right. Now lean back. You know the vibes, dope nation. What be your price? It's the day price, no be today price. You go for one side. Yaro
I
don't
think
try.
you get the point.
Mommy gun short. I be you know the vibes. You go for one side. Yaro don't try. Mommy gun short. I be you know the vibes. Booza. 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 I'm gonna be CME. Booza. 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 Booza.
Okay, so in 2023, it was about cancer. So we basically did something with cancer. And then we had a webinar on oncology in Ghana, advances in treatment, the role of the anesthesiologist. And yeah, basically spent some time. And then we did what they call the cake-off challenge. So basically, anesthesiologists in various hospitals, we made cakes, and then you had to represent anesthesia in the cake. So I don't know if you can see, but the first was Ridge, and that was their cake. The second was Cape Coast, and that was their cake. Fourth was 37 Military Hospital and Cath. We didn't make it to first place, so yeah. And then fifth was UGMC. So 2024, which was this year, was the workforce well-being. I would not want to waste time. So if you'd like to see, just find us on Instagram, Ghana Anesthesiology Society, and you see all the videos. We basically went to a place known as Rock City in Ghana, and then we did a lot of things like hiking, sip and paint, had a party known as Denim on Ice, did some aerobics, and it's all there. So yes, called the Rock City Recharge. So I would like to now come out with what exactly did this whole experience do for me. It just brought out one thing that I would term as fighting fatigue together. Why am I so excited about all the gadgets? It's because it takes some workload off the anesthesiologist, isn't it? But then again, if that can't be done in Ghana, what else could be done? And I'll say fighting fatigue together. So how big is this fatigue problem? If it wasn't big, World Federation would not, of society, Anesthesia Society would not be talking about anesthesia well-being. Anesthesia almost all the years is about the well-being of the physician. And they realize that it's important that you as anesthesiologists would be healthy. Now, all cadres are affected, especially the trainees. As we are in residency, it can be stressful, and your personal life, everything is all over the place. Now, the global incidence of fatigue is like 10 to 59. In Africa, about 17 to 52. Now, to the healthcare provider, we realize that there's substance abuse, broken relationships, some suicide. For patients, there are low satisfaction levels, longer recovery times, incidents of medical errors. Now, in no relationship is the physician more often derelict than in his duty to himself. So to fight fatigue, you have to fight it yourself. Now, we may not have all the gadgets, but this observership has definitely given me a wish list. So this is my wish list. I would wish that we would standardize non-anesthesia roles. I realize that the techs are very efficient here. You have biomedical checking your equipment. You have biomedical just for theater. And I thought that was very efficient because sometimes we have to get there, check our machine and realize there's something wrong with the machine before we call biomedical. And sometimes it takes them a while to get there. So that whole morning in theater, we may not have the case being done. So if we could standardize non-anesthesia roles, like give people certain roles and train them, the non-clinical staff, that would be lovely in my setting. Now, I also got the chance, thanks to Dan, I went for a simulation and saw Quabs and the team try to help a patient. And I thought that really helped or should help in our practice. So I feel in our little setting, if we could do simulations, that would also really be helpful. And then there's one thing that I saw in the clinic that I also thought was really helpful was the telehealth. So patients don't actually have to travel all the way here to have pre-op assessment done. In our setting, it may be just a bit difficult, but it's doable because I see a lot of people using Wi-Fi now. They have network wherever they are, mostly in Ghana. So they don't have to travel all the way from the north. And you realize that when I showed you Ghana, we are somewhere at the bottom. So all those at the top come all the way to Pomfanoche. And sometimes it's not sometimes, most of the times they will have to ride the bus. Sometimes it takes about 8 hours, 10 hours, all the way from the north, sitting in the bus to come and get medical care. And when you come, you see the surgeon and he says, go for pre-op assessment. You come to our clinic and we book you. So you may not come for pre-op assessment that same day because you have to have some labs done and everything before you come back. So these people who have traveled all the way will now have to find a place to sleep somewhere at Pomfanoche. So at night, sometimes when you walk around the hospital, you see people sleeping in the corridors and all that. And I feel that this telehealth would really help those coming all the way from those far areas. And then the lunch and coffee breaks. I realized that there's a resident who always comes and says, can I do your lunches? Before I didn't understand what it meant, but it just meant you would come out of theater and he would take up so you could get something to eat. So I feel that in fighting fatigue, that's something that will actually help. And then you had peripheral nerve catheters. This is just a wish list. I mean, if we get it, fine. If not, well, we are still doing the blocks anyway, but yes. And then you have pulmonary artery flotation catheters standardized in your cardiac theaters. Your Ts are done like you could have access to water, like you have access to teas everywhere. And that was really nice. So, I mean, if we had esophageal probes, at least with all the ultrasounds that we have, it would be a start to something. And then the EMS charting was the best part. The fact that you don't have to chart and then look on the monitor and then chart. And that was, and the acute pain service. So I know that my facility is still trying to establish like a proper pain service. And so it was nice seeing how it's run here so that when we do start, I may have some ideas on how we can, put it all together. So that was a good one as well. Now, yes, this is something that we all do have. I'm really touched by your kindness, all the residents, the attendings. You've been very receptive. I didn't expect you guys to be this warm, but you've been very warm and I appreciate all of you. So I really love that. But yes, in Ghana, we are also very warm. So I would like to encourage you to come to Ghana and experience our warmth as well. Yes, and I feel if we could create some guidelines and flexibility where people actually do research and teaching outside the clinical work, because sometimes the clinical work can get really stressful. And I feel being outside a bit, knowing that you're not on call, but you're doing something else in research may be a way to fight fatigue. And then one thing I'd like to push is, now that I've been able to meet most of you, you're all very lovely. If we could have these support groups or this kind of pen pal system. It can't be called pen pal because we'll be using our phones or gadgets. But basically, first year residents here, so first year residents in Ghana, first year residents here will have a page where they had maybe an interesting case, they could put it up. Oh, we had this case, we managed it this way, this way, this way. You guys have an interesting case, you also put it up on that page. And then there's like, you know, that interaction of what goes on in Kansas and what goes on in Ghana. The same for second year residents and the same for third year residents. I thought it would be nice to be able to establish something like that. And so, yes. So I've come to the end of my presentation. Thank you so much. And any questions? Or any contributions?
Hospital colleagues and what they do, not only in the hospital, but thinking like for the community, wellness, and what I'd like to say, you had a wish list perhaps of maybe 10 bullet points. So, and one of the things I hope, you know, when we go to Ghana, we could get one or two things and bring back. Of those 10 bullet points, what do you think is doable? Or what would you recommend when you go back to Companoche?
So for the training of the non-clinical staff, I think it's very doable and it will be very, basically it will have an impact, very impactful. That particular point, having the non-clinical staff trained would be very impactful because then we will be less burdened and then it would really help with the fatigue. And also, I feel the peer support group is also very doable. It's not something that should be difficult, but maybe there should be a control. So maybe we need to think about how well it can be done so that it doesn't get out of control. But it's also a very doable point. Yes. So yes, I think those two.
You mentioned, you say you just put the internet with Zoom, with WhatsApp. Nice thing on WhatsApp, you go on the Wi-Fi and a call or a video is free. So it's like, yo, why couldn't we meet them? And even those that may not be in the global health tracking, thinking, okay, in 2 years, or 1 year, 2 years, I'm going to go to Ghana. But still, to meet someone from another culture and learn would be beneficial. For those that are going, it allows us, I think, not only to think about education, but perhaps a research project. You know, one of the things, especially like, is just the telehealth that everyone has phone. So, you know, could we not do a project getting data on satisfaction and patients beforehand, and then, you know, then do an intervention, start, and say, okay, now we're going to try to do telehealth, and, you know, and see how it works. Things like that are doable. I think one thing too, which I've tried to do over the years is, and one thing I like, did you notice on their shirt, Ghana, is anesthesiologist or anesthesiologist?
Anesthesiologist.
Look at the gas. Isn't that a pretty big acronym? But you know, are there things that we can do? It was sort of like I was walking around the hall, and one of the anesthesia techs alerted me, okay, we're going to upgrade blind scopes. And so I asked the equipment marathon representative, what are you going to do with those old ones? And they said, well, we're either going to junk it, donate it, or sell it. I said, well, I'm going to Ghana. Can I take one over to Ghana? So so we did get one. The same thing was Nash Mansfield, under Biomed. He said, well, we're gonna upgrade our ultrasounds. We have this one. The hospital donates them, which with that I have to say, I have to thank the hospital for having their donation program, the Biomed, for letting it that connection. We were able to connect that and also with figure out how to get it over there. I mean, there are things that Amma mentioned. She had 67 medical students to teach airway, and I 5 years ago brought and donated mannequins. So I think, are there things we can do as a problem that could maybe be a resident project with things like airway equipment, you know, that we can get? And I bought stuff on eBay. It's a lot cheaper on eBay. Buy it. And then every year, you know, we go over to Ghana. Ghana comes over, the respiratory therapist in April. You know, maybe there are things that we can do as a department and as residents, as staff, you know, to have an exchange with them to help them. And then too, that one thing I really appreciate going over there and I've learned is how well you are with physical diagnosis. And you more or less, you're a very complete doctor. It's like you say, you get a training in 2, 3, 4 years before doing 2 years before a medical officer. And a lot of the things they rely on, where we rely on monitors, they rely on the patients. You know, the decision to transfuse when it maybe take a long time to get a hemoglobin. I've been amazed how you do a very excellent job giving anesthesia with your box of medications. You don't have a large fixes, so you do an excellent job, and I think we can learn those things from you, as well as just this morning learning a different way of doing a nasal intubation of how they do if they don't have a wide scope. So I hope that with our global health track, I hope every year we'll have a global health resident that will then the idea of going to either Peru or Ghana. But even those of you that aren't going through the internet, through the phone, we hopefully can keep this connection. Because not only do we have Robin as a resident, but you know, Dr. Serafina, she's a Ghanaian American. And so we have this special connection, I think, with Ghana. It's also, I think, the English language. Now, Peru, I think of that as advantages to help your Spanish. But they think we can also learn from them. But any of you in the future are interested in global health education, working with Father, and I do want to give him credit. He has done an excellent job, even to have a welcome for the visiting residents. I have met the Peru residents who will come next year. So next year, in addition to Ghana, we'll have Peru. But I'm so happy you're able to come here, and
They'd like to ask questions.
we're out of time.
No, they want to ask questions.
Oh, okay. I'm sorry.
Bridget, I think I saw your hand first. You want to
Trust
ask
me.
Bridget?
Bridget, I think you can ask
Okay, I was
questions.
waiting. I hope you can hear me.
Yes.
Okay, I was gonna say thank you so much for such a wonderful presentation. Myself, I was born in Ghana. I spent some of my growing up years there, but I haven't been back in a very long time. And so it was really nice to see all your pictures and, take a journey back. But I guess my question is, I know you've shared your wish list and some of the things that you would like to see in hospitals in Ghana. But personally for you, based off of your time here in Kansas, what do you think you're taking back with you to change the medical terrain in Ghana? so that when people look back, they can say, wow, it's Alma who did this. Alma is the one that came up with this idea based off of your time here in Kansas.
Like what I'm taking back from Kansas.
Yeah, to go with you to Ghana to sort of like change the medical terrain based off of what you've learned.
Okay, so it was easier to see and keep in my head. So, like I was saying, we don't have much cardiac cases in my center. So, seeing the coronary artery bypass graft machine, seeing how it works, asking all the question about the pumps and all that made it easier for me to get it all stuck in my head. Even though I'm done with the exam, I still am involved in teaching residents, so it will make it easier to let them picture how some of these things work, and it's not just like you're reading. So for me, I know that it will help with how I teach other residents and the younger colleagues. So yes, for that, I would say maybe that's what I'll take for myself and how maybe I'll impact Ghana and the program. Yeah.
Well, I look forward to reading about that sometime in the future. Super
Okay.
cool.
Okay. Thank you. Dr. Adams.
Yes, thank you very much for a very interesting presentation. Mine is more a comment rather than a question. I just wanted to let you know, and everyone else in the room know that of course, the KU Medical Center is associated with KU in Lawrence, the university sister campus of the KU Med Center. We're about a 45-minute drive or an hour drive, depending on how fast you drive, away from the med center. And at the KU Lawrence campus, we have across all the campus actually, but we're based in Lawrence is the Kansas African Studies Center, and we have a lot of programming that we do with colleagues across the African continent, but a significant presence also in Ghana. And we have opportunities to facilitate some of the things you were mentioning, like exchanges between students, online exchanges between students. We'd be very interested to work with you on some of those things. Dr. Trujillo, in respiratory therapy, we've provided some funding for a collaborative online international learning experience, a COIL experience. We have some more of those available if there are faculty in the room who are interested and they're interested in working with faculty at Campo Noche. That would be good as well. But I'm hoping I'll make it to KC tomorrow to have the opportunity to meet you in person. If not, then maybe I will see you the next time I'm in Ghana. I'll make a trip to Kumasi and check out
Yes.
the facility there. Thank you very
Okay.
much.
Thank you.
And don't
Thank you.
hesitate to contact me. I'll send you my details and anyone else in the room if you're interested to know some of the things that that we have at KU connecting to various African spaces and the initiatives we might do together. I think I heard some interesting ideas here, and I'd like to work with people on those.
Yes, please. Thank you. Thank you.